why NSAIDs can worsen hypertension and kidney functions, and how a patient on Ramipril and furosemide for high blood pressure can develop acute kidney injury after taking ibuprofen, that is NSAIDs. I will be discussing this topic because medications like Ramipril, furosemide, ibuprofen are commonly used and often found in our home. However, their interaction can have serious consequences on kidney functions and overall health. NSAIDs inhibit the COX letter cyclooxygenase and result in decreased prostaglandin levels in the blood. The prostaglandins normally dilate the afferent arterioles in the kidney and thus increase the glomerular filtration rate. Without prostaglandins, there is vasoconstriction of afferent arterioles, resulting in decreased the glomerular filtration rate. So the kidney filtered less fluid and waste. GFR tells us how well your kidneys are filtering blood. High GFR, kidney working well, and low GFR, kidneys are under stress or not working properly. Decreased the glomerular filtration rate. Less fluid filtered, more fluid stays in the blood and leads to fluid retention, that is swelling in legs and weight gain. So more fluid in the body will result in more pressure inside the blood vessels and result in increased BP. Also, prostaglandins help the kidney by keep blood flow strong and promote sodium excretion. So when we use NSAIDs, they decreased the prostaglandin levels, result in reduce the blood flow to the kidney. As a result, the kidney receives less blood for filtration, and from whatever little blood they do receive, the kidney try to compensate by increasing sodium reabsorption. This leads to sodium retention, and water follows sodium, resulting in increased fluid retention, increased BP, edema, worsening the heart failure. This sodium retention is more likely in elderly, heart failure, CKD, or those on ACE inhibitors and diuretics. That's how the non-steroidal anti-inflammatory drugs like ibuprofen can increase your blood pressure. Why a hypertensive patient on Ramipril and furosemide, if taking NSAIDs, can land in acute kidney injury? This is what we call the triple whammy effect, referred to a dangerous combination of three types of drugs that when we take together can seriously reduce the kidney functions and may lead to acute kidney injury. These medications decrease blood flow to the kidney from different angles. As we know, the NSAIDs, by decreasing the prostaglandin levels, constrict the afferent arterioles and leading to the decreased blood flow to the kidney. Normally, what happens when the flow of blood decreases in the kidney, that is during renal hypoperfusion, a compensatory mechanism of body that activates the RAS system, that is renin angiotensin aldosterone system, that is renin is released, which leads to the formation of angiotensin 2 from angiotensin 1. The angiotensin 2 is a vasoconstrictor. It constricts the efferent arterioles. Constriction of efferent arterioles by angiotensin 2 increases the pressure inside the glomerulus, which helps to maintain the GFR, especially during low renal perfusion. So with the NSAIDs, if we use ACE inhibitors, that is Ramipril, which block the conversion of angiotensin 1 to angiotensin 2, results in decreased angiotensin 2 levels. With decreased angiotensin 2 levels results in vasodilation to the efferent arteriole. So whatever little blood comes into the kidney further drain from the kidney by the vasodilation of efferent arterioles. As pressure inside the glomerulus is decreased, the combined effect leads to both reduced blood entry and increased outflow from the glomerulus. This results in marked reduction in the GFR, and if we further combine diuretics, as diuretic reduces the total blood volume, results in further decreased in blood flow to the kidney, results in marked decreased in GFR. So all three together results in very low kidney blood flow, results in severe decreased in GFR, and lands in acute kidney injury. So never give all three together, especially in elderly, dehydrated patients, heart failure and CKD patients.